Today, I want to talk to you about kidney stone disease. Kidney stones can sometimes be easily confused with other illnesses. Our patients may come in complaining of side pain. They may also present with complaints of burning during urination. At this point, it's really important to distinguish whether the patient actually has a stone or not. Sometimes, the symptoms can be mixed up with lower back pain, herniated discs, or other different conditions and diseases. When our patients first come in, it's very important to listen to their complaints and medical history. What kind of symptoms do they have? Usually, the pain is on one side and occurs on the flank. If the stone has moved further down the urinary tract, closer to the bladder, patients may experience groin pain, frequent urination, or a burning sensation while urinating. Many of our patients come in with complaints of blood in their urine. This is because as the stones pass, they can cause scratches or small injuries in the urinary tract, leading to bleeding in the urine. There can also be symptoms like nausea and vomiting. So, what do we do to make a definitive diagnosis in this situation? First, we perform a physical examination of our patients. We try to determine if there is truly pain in the kidney area. Then, we conduct urine tests. We proceed to imaging methods. For imaging methods, our first choice is usually X-ray and ultrasound. If we're not completely sure, or in cases where we're undecided, or if we're considering surgery for the stone, we may also request a CT scan. When it comes to treatment, we have several approaches. Generally, stones up to half a centimeter, that is, up to 5 millimeters, have a high chance of passing on their own. To help pass these stones, we prescribe effective treatments and certain medications. We give our patients some time to allow the stone to pass. If they are able to pass the stone within this period, that's great. But if the stone doesn't pass during this time, we move on to other treatment methods. If we talk about what these are, in the past, a lot of open surgeries were performed, but nowadays we don't use open surgery very much. With endoscopy, we can remove many stones by breaking them up using methods like laser or what we call pneumatic techniques. If there are stones inside the kidney, or if there is a stone that cannot be treated with endoscopy, we can treat it with methods known as percutaneous or kidney stone surgeries. Of course, if the stone is not suitable for any of these methods, open surgery can also be performed. We are generally able to treat about 90% of our patients with endoscopic surgeries.